Welcome, I'm Barbara Marcum, a gerontologist that works with the City of Westland doing some outreach and also some public education. So today I have Dina Vannice and Stephany Bronsted from the Information Center, which is one of the places that I think is the greatest as far as resources. Love the Information Center. A lot of people maybe haven't heard of it because A, it's in Taylor, okay, but B, a lot of when people look for resources, because the Senior Alliance is an area agency on aging, they often get referred to the Senior Alliance. You guys do much, if not all, of the same things that the Senior Alliance does. So I wanted to make sure everybody knew about you. Welcome today.
Thank you for having us.
Oh, it was my pleasure. So Stephany, tell us a little bit about your background first and how you ended up at the Information Center.
Absolutely. I have a background of community mental health, specifically with mental health and substance use. And then from there, I transitioned to children's mental health. And then I found the lovely Information Center. So what drew me to the Information Center is it provides resources from pre-birth to senior citizens, so everywhere in between. And it helps with anything you can really think of. So rental assistance, housing help, getting out of a nursing home, going back to your own home to receive services. So it's really providing resources to any individual that may need it. And we provide services that people don't even know are out there. So that really drew my attention in, of just really helping everybody and letting them know that there's resources that you just may not know that are there.
Wow, so yeah, that was a good fit for you then,
Yeah,
right?
absolutely.
Fit right in here. Okay, Dina, you and I go way back.
Quite a ways back, Barb.
Yes. Wow, give us a little bit about your history and about you being at the Information Center. I feel like I've known you through my whole career. So let's hear about you and some of your background.
Okay, so I joined the Information Center in 2010 after a 30-year broadcast career. The majority of that was in Detroit and some in Canada, on air. Loved helping people. While on the air at CBS Network, we were involved in so many nonprofits, Children's Hospital, the Gail Purton Ovarian Cancer Fund, you name it, DMC, just numerous charitable organizations, the Salvation Army. So when I retired from broadcasting in 2010, Barb, I just wasn't finished. I really wanted to work for a nonprofit and I wanted to do something charitable. So I actually went to SEMCA, Michigan Works, and literally there was a job opportunity for an information and referral specialist, which is the person who's trained to answer those phones and connect people with those services. And I just called them and set up an interview and asked them if I could please come in and offer them what I could do for them, mainly media, promotion, get them some exposure. So after 5 long meetings, I was hired, yes, with Edward D'Angelo. I absolutely loved him. He was our previous CEO. He's retired now. Beth Grant is now our CEO, doing a fabulous job. But Ed interviewed me for 5 long meetings, along with the deputy director, and said, sometimes fate just smiles on you, Dina. We'd like to hire you, and we'll create a position for you. So that's my trail, and I've loved it ever since. 2010, history. Yes, I'm going into my 15th year, and I absolutely enjoy what I do. And once again, it's connecting people with services and programs that are free. Your taxpayer dollars pay for them. Free services that can help them.
No, I think it's great. And you know what's really even more important, and Dina, you and I have had conversations about this. If you're going to work with the public, you need to love people.
You do.
Okay.
Absolutely.
So the thing is I love the way the Information Center treats people, and getting a timely response. And let's just go ahead and Stephany, you can tell us about the call center, because that's really important as far as dealing with somebody and not getting a recording that you'll hear from someone within 48 hours. When seniors call for something, they want it. They're probably in a crisis at that point, and I need some help, and that's the last thing they want to hear. So tell us about the call center.
Yes, so with the call center, we are open Monday through Friday from 9 to 5, and we have someone answering the calls that entire time. So if you call, you're going to get an automated system, but it will take you to the receptionist, who will then guide you over to an information referral specialist. So you will be able to talk to a live person, We just go over hey, your call may be recorded for quality and training purposes, which it is, and then you will be connected right away to a live person to better assist where you need to go and route your call the right way. So you will definitely be talking to someone on your initial call.
Well, that's really great. And Dina, you and I have talked about that numerous times and how important that is. Let's talk a little bit, people who, I can tell you just by going on to Medicare, seniors are not technologically savvy. There is a couple of generations that are in the dust, okay? When now they're trying to go to everything being computer generated, there are people in their 80s and 90s and older that they are expecting to be able somehow, some way to get to that information, to get on different programs. To me, it is terrible, okay? So you can tell me about your feelings about that, and then we'll talk about the Medicaid waiver program.
Well, first of all, there are several generations that have been just left out through that entire transition, from obviously pen and paper to the DOS system, and then you can go on into the PCs and so forth. I know you and I had talked on the phone previously a few days ago, and I love that my father-in-law was on a PC, and we'd only get a little email from him once in a while, and it would say, "Hi, how are you?" And that was as far as he went. And I talked about my mom and the mail station, and there was a mail station that was put out years before web TV, and it was just this little station, and she would just connect with her friends through a phone number, and she didn't have to look for apps, and all she did was just type in, "Hi, how are you, Miss Patello?" And they would get their little mail back. It was almost like you got mail before you got mail. The film came
Right.
out. And that was their extent of it. But then you have my mother-in-law who won't touch a computer, who does not want to learn about computers, and she's something like 90 years old.
Yeah.
So you have that whole generation who can't connect with their caseworker any longer. They can't connect with people verbally, and I think that's just really, it's just disenfranchised them in many ways. There is a library nearby, I'm sure, where they can connect with PCs. But Barb, let's face it, transportation can be an issue, and you know that too, Stephany.
Absolutely.
So that's not the all-in-all answer.
And not only that, like we just talked about before, if you're working with the public, you should love people. Try to get help when you
Yes.
say, "I don't know anything," and you go to the library and sit down.
Right.
You're on your own.
You are. You absolutely are. But yeah, I think that we should be, and we are doing some things about that. As a matter of fact, the health insurance, when people come in, they can definitely, you could talk a little bit about that, right?
Absolutely. So what we do is anyone, if they prefer to come in and be face-to-face with an information referral specialist, that's what we're there to serve the people. So we can walk you through the application. If you're more comfortable with someone doing it for you, we more than happily will. You'll be alongside of us, helping us answer the questions accordingly. Anyone can give us a call. You can reach us email, calling, mail, stopping in. Any way you can, social media, any way you can think of reaching fax, any way you can think of reaching someone, you can reach us. Again, if someone is having issues filling out something or needs that little extra help, we are more than happy to have them come in person if that's what they would prefer. Excuse me. Because a lot of people just want to have that face-to-face interaction, see who they're talking to. Because so many things nowadays are so far removed from that you just want to see who you're talking to and have that friendly face. So we're here to help people. I know Dina said pen to paper. We definitely provide services that way. For people who are more in the tech realm or do want that secondary way of receiving resources, we can text them too. We can email them. We can do all three. We can mail them. We can fax them. We can drop them off. You know, whatever someone prefers, we just want to make sure they're getting the help and services that they need.
And giving them that personal touch.
Correct.
And I think that's what's really important with the Information Center. When you look at the Information Center, that's who we are. We're grassroots. There's no corporate. We have a board of directors, obviously, but we have no corporation that tells us, oh, you have to do it
Exactly.
this way and all the bureaucracy.
And a nonprofit.
Right, we're a nonprofit. We're a nonprofit, and we started grassroots. We're still grassroots, and that was the whole purpose. I was just talking to our founder, Jeffrey Padden, over the weekend, and I believe there were 5 founders altogether. He was our lead founder, and we're getting ready for our 50th anniversary, so I'm gathering information. We started in Wyandotte on Elm Street in a small office, and then moved just across the street to Biddle. They started with a Rolodex. You know, we're talking about a call center that started 50 years ago. So I
had a
think
Rolodex.
that, yeah, I had one too in the day, right? I might still have one in the basement.
Yeah.
But that's how it started. So how have we perfected that over the years? Oh my goodness, with our information referral specialists. They're not just someone who answers the phone. It's not just a receptionist. These people are trained. They know the resources that are out there. And when people call in, they know exactly how to zero in on that zip code, that city, to give them the resources that they need. And where to turn guide, oh my goodness, that whole group that we have, the staff that we have to perfect that particular document that goes out every year.
It's got everything in it.
Oh, it does.
It literally is where to turn.
Hello.
Yes.
I brought one just to show you, and I brought some for you. So after the show or after the program, we'll definitely pass those along. But this has many, many resources, and you can just go through the index, everything from food, shelter, all the basic needs, health insurance. Someone has autism, we have those autism groups, support groups, the Alzheimer's support groups, and so forth. Just so much. But the staff that goes through this with a fine-tooth comb before it's published at the end of August, oh my gosh, it's amazing. We don't give bad resources. We provide very good resources. They're up to date, and we distribute 20,000 of those into the community. So that's all throughout downriver. That's 18 cities, all of Monroe County, western Wayne County, out Wayne County, which includes you, obviously, Westland, Garden City, all throughout this area too, and up that 275 corridor.
Yeah. Well, you know, it's interesting because you are not just for seniors. You have a lot of seniors that you help, but you help everyone.
Yes.
You know, and I think that's really the important thing, is no matter, you say, oh, I can't call there, you have to be 50 and older to go out, you know what I mean? There's none of that.
No.
If there's a family,
Absolutely.
grandparents,
Right.
you know what I mean, children, whatever, you can call and be able to find some help and somewhere to go.
Absolutely.
Okay, so let's talk about your other, like the Medicaid waiver and different things that you have. What kind of programs do you have, like the Medicaid waiver, and what is that?
Yeah.
Okay, and who qualifies for that?
So with the Medicaid My Choice Waiver Program, it is for individuals that are 18 and older that have a disability, or for individuals 65 and older. So what the Medicaid My Choice Waiver is, it gives you the opportunity to choose where you would like to receive those medical services, either in your own home, an assisted living, independent living, and so forth. You get to choose where you want those services. Some of those services include respite services, a caregiver, home modifications, transportation, home delivered meals. Those are just some of those things that come with that program, and many more. It is based on that individual's need. So
And income.
correct, yes, and the income is $2,829 per individual. So if you have any other questions regarding the requirements for waiver or what other services are offered, please, please, please give us a call, 734-282-7171.
Yeah, I think that's really important. The waiver has really opened up some choices for seniors and, well, for anyone, regarding where they want to live and what they need.
Yeah.
Because $2,800 doesn't go a very long way. Now, I know that the waiver won't cover rent, but it will cover all of the other services, like maybe laundry or housekeeping, medication reminders,
Absolutely.
you know, all of those things as well, because people are very disheartened when they go and, you know, they say, well, what does it cost to live here? And it's like $6,000 a month, and it's like, what? I don't have six. So automatically, without calling or anything, they say, well, I can't afford that. When there are programs out there and people who can lead you to those
Absolutely.
programs.
Yeah.
So that's, that's what you do. So I always tell people, don't think just because you get information and you think that you don't qualify. Talk to somebody who knows.
Yes.
What kind of people do you have on your staff? Do you have nurses? Do you have social workers? Do you have what kind of? Yeah.
We do, Barb. When I think about the information center, the best way to explain it is there's two parts to us. There's the call center and there's the care management department. So you're talking about our care management department. So we have those social workers and nurses that go into the community that help those in the community live in their homes independently longer. And those are the programs we're talking about when we talk about waiver. What a fabulous program that is, My Choice Medicaid Waiver. And we also have the Community Transition Services Program.
Yeah, what is that?
That is a cool program that actually will take those who are eligible on Medicaid out of the nursing home situation and bring them back into the community.
Yes, exactly. So say, for instance, you are in a nursing home and you want to not be. So what we can do is we can get you transitioned out of that nursing home into either your own home, an assisted living, a family member's home, independent living, what you see fit, get you all set up there, can help you get furniture, get medical services in place, and so forth. So if you are currently in a nursing home and looking to transition out and it is medically safe, we are the team to do it for you. We can definitely help with that. And then if you are also interested in a waiver, you can do that as well. It's not one or the other. We can help you with both. And what's so unique about us, the Information Center, is we're one of the few agencies that do provide community transitions. So I think that really sets us apart. And jumping back to waiver a little bit, we also do not have a wait list, which other agencies do.
A long wait list.
Yes.
In some cases.
Yes, unfortunately. Yes.
Yeah. I have my ex-mother-in-law is now in a place, and she really wants to go home, but the problem is she lives in a 4-story home.
Okay.
And she literally face planted into a wall, and her face was completely black and blue and green, and she wants to come home, and it's like, this shit's just not safe for her, regardless of whether she has somebody there.
Right.
You know what I mean? So nobody wants to be in a nursing home.
Right.
But perhaps, even if their own home is not feasible for whatever reason, doesn't mean that they necessarily have to stay in a nursing home.
Correct.
You know what I
Absolutely
mean?
correct, yeah.
So looking at the other possibilities, and actually, and I think when it comes down to it, and talking with seniors for the last 26 years, I find that most of the time, if common sense does prevail. When you sit down and you say, okay, well, what about this or what about that? And they understand that, okay, this probably isn't the best idea for me, but I just don't want to be where I am right now.
Right.
So helping them find the solution to them being happy, because I can tell you, when they're not happy, they're miserable.
Yeah.
And they just can't climb out of the hole.
No, and they will wither away a lot quicker.
They do.
So they need that support. So what I really love is in the last 10 to 15 years, there have been companies and even partners of ours that have risen up, parents changing spaces.
Let's talk a little bit about that.
Some of those, and
Yes.
total transitions. And these are people that actually will go into that 4-story home and say, okay, what can you do with, what can you not do with, right? And let's scale down, let's get an estate sale going on, let's sell the house, and these people are for seniors, right? They're not against seniors, they're not trying to get your house for a low price and sell it to someone else for $500,000, because we have those out there too.
What's the brigade one? Bridget?
Betty Brigade,
Yeah,
yes.
Betty's Brigade, okay,
Yes.
yeah.
So what they'll do is they'll come in and help you scale down, help you sell your house if that's what you'd like to do, and then move into a more appropriate, maybe a condo, maybe an apartment, maybe assisted living, and help you. Vicki, one of my friends who has total transition, she actually worked with Hospice of Michigan for many, many years.
Love hospice.
So what a heart for people, going in there and saying, okay, we understand where you are, let's see if we can help you. So these are some of our partners. These are some of our Where to Turn Guide advertisers. These are people that we've known for years. And not to throw businesses out there, it's just that seniors do have choices, more choices than they
absolutely.
had.
Than ever before, for
Ever
sure,
before.
for sure.
So you have to make that decision, and it's a family decision, it's a personal decision. But when it's time to scale down, it's time to scale down. And if you have to move on, just don't feel trapped. Ask for help, ask for support, and I'm sure we can connect them.
Absolutely.
Well, a lot of that trapped feeling comes from adult children.
Well,
Okay, so it's like, and so many of them, it's like even if you have a close relationship with your adult children, you're in your 70s, they're in their 50s, and they have a definite idea about what they think you should be doing. But the thing is that you have a right to choose until you don't have the ability to choose anymore.
right.
And so I always, for me, one thing, oh my gosh, this really bothered me more than anything. It's like probably the best place to be would have been assisted living, which was quite expensive. And I literally had an adult child say to me, but that's our inheritance.
Oh my goodness.
Oh yeah. I'm sure I shot daggers right then and there.
No doubt.
It's like your parents worked their whole lives to be comfortable.
Right.
At that resource is for them. Whatever's left over when the journey is done
That's right.
is icing on the cake for you, but certainly not until then.
Exactly.
I was furious.
Of course.
So I think while people are in their 40s and 50s, they really need to think about who they want to be a power of attorney.
Exactly.
You know what I mean? Those decisions are crucial.
Very much so.
To them. Should they have a stroke? Should they be unable to make decisions? Boy, those kids will throw you somewhere where the cheapest thing, right into adult foster care, and so, and like you said, slides the downward slope.
That's right.
When people are unhappy, when their needs aren't being met, when they want to make some changes and they can't do it, or are powerless to do it, or feel powerless to do it.
Right.
Just a nightmare.
It is a nightmare, and unfortunately, they go a lot quicker.
They do.
They go a lot
They have no
quicker.
reason to live.
Depression sets in
Yes.
and all that. So what you do, as you said, in your 50s or 60s, think it through, get that living will done, all those things that the hospital tells you to do when you go to have screenings and surgeries, get those things done, because you could end up in the same situation I was with my first husband, who died of Huntington's disease.
Yeah, tell a little bit about that.
Yes.
Viewers love stories.
Okay. He was my first husband, and I met him when I was 16 and a half. And we married when I was 26, had to get through college and all that and start the career. Wonderful man. Unfortunately, he was diagnosed with a hereditary neurological disease called Huntington's disease, and he lived with it for nearly 30 years, which is almost impossible if you read anything about Huntington's disease. Essentially, he ended up on the waiver program, the My Choice Medicaid waiver program, because we were very young. 6 months after we were married, you are not planning children, you're not buying a house, you're not saving for retirement. Essentially, you're young, right? And so with the waiver program, and I know it's changed a little bit over the years, but not that much, they take the income of the person who is ill, the person who is diagnosed with the disease.
Not a combined income.
Right,
How
not a
unfair
combined.
would that be,
and they
right?
still do that. And so essentially he was on that program, and I just applaud the program. The program is amazing. It helped us. His care, the last 4 years of his life, was around $100,000 a year, which I did not have to pay.
How old was he then?
He died just before his 51st birthday.
Oh boy.
And he passed on in October of 2002. And I remarried. The good part about it is I remarried, and I have a 19-year-old now from my second husband. And I'm just very excited about that, and she's doing really well. But, you look at those situations, and what did happen in the hospital when he had pneumonia, Barb, they ask us, do you want a feeding tube? And that's the point I'm getting to, is that if I did not know what he wanted and he was unable to verbalize,
That's right.
then what do you do? It's a
Exactly.
quandary, because you're sitting there going, oh my gosh, I don't want to do what he doesn't want to do. And he was able to raise his hand for yes and put his hand down for no. And we had a little talking machine that we had received from a friend. So we had little sentences in there so he could communicate by pressing a button, and the sentence would go forth. But here's the thing. He was able to tell me that, yes, he did want that PEG tube, because he did not want me to continue to do the Heimlich maneuver, which I had done probably hundreds of times.
Swallowing, I can't.
And he didn't want to choke to death, and he did not want to starve to death. So what was the option? The PEG tube.
Yeah.
Well, guess what? With the PEG tube, he was able to go to rolling hills and go down in the wave pool and go down the slide. And he was able to go to the lake house, which our friend provided for us for a little respite time. And he really enjoyed his life, and he lived for 4 years with that PEG tube. Sounds almost impossible. How could you imagine not being able to eat, right?
Right.
But as long as you keep your mouth clean
nutrition,
and you brush the teeth and so forth, and you continue to use those infusion supplies, they really don't feel the hunger. And he assured me that he was fine. Now, it's different for everyone, I understand. But at the same time, those are the choices that you have to make. And you need to know ahead of time. You really do.
Yeah, and it's interesting that you say that too, because the other thing about that is like that changed your life, okay? And being able to deal with all of the things that you dealt with, understanding people who are in situations that are awful situations to be faced with, really gave you a base to launch you forward into what you're doing now.
Exactly.
You know what I mean?
When I retired from broadcasting, I said, I'm not finished. And when I saw the Information Center website at that time online, they had caregiver conferences, they were featuring the My Choice waiver program, the Medicaid waiver program, which they're doing now, and community transitions, and I just felt like, wow, this is a fit for me, more people need to know about them, and so I applied there, and like I said, they created that position for me, and now I'm the Director of Public Relations and handle fundraising and media, everything you can imagine, you know, all those pieces that need to be taken care of.
Yeah.
And we work as a team.
Oh,
We all do.
absolutely.
We work
All
as a
of us
team.
do, yeah.
Well, I think that's wonderful to hear. I think the Information Center is great. I thank you, Stephany, and you, Dina, for being with us today. And if you can let our viewers know again the number to reach you or how to get what's the website for the Information Center, go ahead and do that.
Well, you can call us at 734-282-7171 or go online at theinfocenter.org. In addition to that, I wanted to mention the 50th anniversary because it's coming up next
gala,
year.
yeah.
We're all excited about
Yes.
that. So we'll have a big gala fundraiser and details are coming soon. We do have a newsletter that we put out monthly. So sign up for that, call us, email us. You can go to the website and you'll see the information there. Anything else, Stephany?
Just, you know what, you don't know what you don't know. So if you have any questions about anything that you think you need or you may need in the future, please give us a call and we are more than happy to go over everything with you. Again, we're 734-282-7171 and we look forward to your call.
And remember, help begins here.
Yes.
That's right, that personal help, right?
Yes,
exactly.
So Stephany, Dina, thank you so much. Thank you, friends in our viewing audience. I'm Barbara Marcum, and this is Friendship Focus.